everybody. I hope you had time to get the kettle boiled and get yourselves a drink. The next section, we're going to focus on some of the work that we've been doing around supporting our carers. And one of the programs that we've been running is our Carer Peer Support program. There's a video that we're going to watch now, and it will be for carer peer support workers who are working to support those who are caring for a loved one experiencing mental ill health. I hope you enjoy the video. We're very proud of this work.
Hello, I'm Paula Hull. I'm Director of Nursing and Allied Health Professions here at Southern Health. I'm really pleased to be here today to talk to you about the Carers Peer Support Programme. Without our carers working with us in the NHS, we would not be able to deliver the amazing care that we do to people every day. We are developing some roles within our organisation of people who have been carers and have experience of the caring for their loved ones to come and work with us and to help us to make sure that we identify support for people when they need it, that we involve them in the care of their loved one, and that they help us to shape some of our services in the way we need to make sure that carers are really, really central to everything we do.
Hi, I'm Ali.
Hi, I'm Chris.
We're carer peer support workers for the Community Perinatal Mental Health team.
Hello, my name is Elizabeth and I'm a carer who has been supported by Ali. My daughter became ill. She'd had a baby the previous year and had postnatal depression, and it came back in 2020. I had to go and move in with her as there was no other way. So I found myself as a carer to my daughter, my son, my grandson, living in a house where my son-in-law was trying to work as well. So I was there 24 hours a day, 7 days a week. It was very lonely. I had a lot of criticism from friends who said I was breaking the law by not being in my own home. Others said, oh, you're lucky you're seeing your grandchild, which was very hurtful, and I realised none of them really understood what I was going through. It was suggested by the perinatal team, mental health team, that I should access Ali. First I was reluctant, feeling that there were far more cases who need help than me. And then after a week or two I realised that I had no support for me. And if I was going to continue, it was important that I kept well. So yes, I agreed, and they put Ali in touch with me. And I just sat nearly for the whole hour and cried on the phone to Ali. But it was the catalyst for getting some help. Ali had been fantastic on the phone then. I knew that she would listen without judgment. She had some empathy. Just being able to talk about my feelings, about me, rather than what I was going through with my daughter, really.
I was working in Asda and I was on the tills, and I decided the week before that I needed to do something else. and a customer came through and she was talking about her job, and it was in mental health, and I was like, wow, you know, I was saying you're really lucky, I wish I could do something mental health. And she said, well, you can. I said, well, I haven't got any qualifications. So she said, well, have a look on the website, there's lots of positions. So I had a look, and by chance that week this job came up. All we needed was to have lived experience in mental health, where my daughter had been poorly, so I applied. So carer peer support workers support the people that are looking after patients with mental health. We see people one-to-one, so we might meet them in the community or over the phone or on video, and they just talk to us and we listen, and we provide support in that way. We also run groups, so we sort of have groups by theme, so perhaps we might have a nursery nurse come along and talk about babies. It's mainly partners that we support, but we also have some mums of mums and maternal grandmothers, so they come along and they can ask the nursery nurses anything they like.
Carers peer support work is a really exciting addition to our healthcare model. As we know, anyone who's going through a health struggle, a health battle, their family are really involved. A carers peer support worker is assigned for exactly that, the family members, the loved ones, the carers of someone who is a service user, and they can provide emotional support, advice, and they really help to smooth the way of a healthcare journey, to really help individuals ask questions, understand and provide insight based on their own experiences, so service users and their families can make informed decisions about their healthcare pathway.
I've got a couple of carers who literally come on the phone, talk non-stop, they don't need me to say anything, and they say, oh, I feel better now.
Yeah.
And then they go. And that's like interesting, isn't it? How different people
It's an emotional
need
download,
different
isn't it?
things. Yeah, literally. They don't need me to say anything.
Yeah.
They just need someone to talk to.
And then whereas other ones that I've worked with, I've set them homework to learn to boil an egg. And I've set them
Have you
homework
literally?
to go and read a book for 1 hour a day.
Yeah.
And you know, things like that, things that are practically helping them, things that are helping them with their own well-being, helping them to relax and have time to themselves.
I'm just so grateful to Annie that she was there when I needed her most. I'm just so incredibly pleased that someone had the foresight to actually create these posts to help carers. I just think they're so vitally important. Without it, I don't know where I would have been in 6 months' time, probably needing support from the mental health team somewhere else.
I can't overemphasise the difference that they are making, and it comes home to me when I do the carers groups that we run for the Trust, and when I hear carers talk about how they are being involved in meetings about their loved one, about how they are being asked to put their expertise and how they feel recognised for the incredibly difficult, challenging jobs that they do every day. You know, we pop in and out.
And so what's the future for Carer Peer Support Worker Programme?
The future for Carer Peer Support Programme is grow, grow, grow. We want more, and we are 100% committed to getting every carer in Hampshire linked in and supported.
And what would you say to someone that might be interested in becoming a Carer Peer Support Worker?
If you're already thinking about it, then you're probably the right person for it.
What would you say to a carer that's in your position, who was in your position? What would you say to them?
To seek help. It's so important that you keep yourself well.
What a fantastic video, and just seeing that, it kind of brings a lump to your throat, really, just the power of having somebody to talk to when you feel lonely and alone and isolated. It's just incredible. So a great project that has been developed, and we hope it continues and flourishes, and I'm sure it will. Our next section this evening, I'm going to introduce to you Heather Mitchell, who's our Director of Strategy for the Trust. And Heather is going to present to us how we're transforming our hospitals and how we will and we are working differently. So thanks, Heather, over to you.
Thank you, Lynn. I'm hoping now I am sharing screen, which says our strategy.
Yes, you are.
Brilliant, thank you. So I'm Heather Mitchell, I'm Director of Strategy and Infrastructure Transformation. I'm just going to spend a couple of minutes, just at a very high level, introducing our strategy and our high level priorities this year. And then going to share some success stories, both through a video and through Naomi Purdy, who's going to talk about one of our services. This slide just shows a very high level vision and purpose, and how we want to implement our strategy going forward. It very much talks to working together in partnership with our carers, with our families, patients and service users to deliver that outstanding care and treatment, but also to really listen to people's needs and to tailor our care and support to meet their needs, and using those perspectives to continuously improve and develop our services. And that's embedded through our approach around our delivery of our strategic priorities. This slide then just shows at a very high level some of our key priorities and things we want to deliver over the next 2 years. Sorry, I'm getting quite a lot of noise over. I think we need a microphone on mute. Apologies. Okay, so this just shows some of the really key high-level projects that we want to deliver. Now, I'm not going to talk to these in detail, but really talk about the benefit that we'd get through delivering these programmes of work. So these are in line with the NHS long-term plan, and there's funding coming down nationally to support investment into mental health and community provision. We want to provide more proactive preventative care that supports wellness and well-being and is more recovery focused. We want care that's easy to access, that's easier to navigate, that's more joined up and links in with services within our local communities from the voluntary sector and other third sector provision. We want care that's outcome focused, that's personalised and is holistic and addresses people in the round around both mental health and perhaps physical health needs. And that's delivered in partnership and co-designed with our patients, service users, and with our system partners. And we want to, through these priorities, address some of the gaps in provision and make sure that we're meeting the growing demand for care. So I'm going to reflect now some examples which demonstrate this in action. So first, I'm going to introduce Naomi Purdy. Naomi's a consultant nurse in frailty. And she's been delivering an urgent community response service, which has been set up during the pandemic and brings in urgent response to people whose health is deteriorating, who are at risk of a hospital admission. And it supports them within their own environment wherever possible. So I will stop sharing and hopefully Naomi can come in and share her screen.
Thank you, Heather. I'm just about to share there. Is that sharing?
Yes, Naomi. You might want to put it onto presentation format, but we can see your slides.
Lovely. Sorry, we use so many different platforms of communication. I'm adapting to each one as we come along. So anyway, thank you, Heather. So as Heather says, I'm Naomi Purdy. I'm one of the consultant nurses for frailty. So the urgent community response team that we set up over the COVID period is it's a multi-professional team that provides a rapid assessment, diagnostic and treatment to prevent hospital admission. So we've aligned our services so we're integrated with adult social care. So it then provides a seamless service to support patients to remain at home once their physical health need has been addressed. And we also use a one team approach, and this allows alignment with our GP surgeries and our PCNs to enable provision of that holistic care and that personalised care to individuals. And this is done then by that multidisciplinary approach by the right person at the right time. So I'm just going to move on to the next one. So our UCR team is defined by 4 pathways that we've developed. So the first one is that rapid response. So this focuses on admission avoidance for patients with acute ill health needs. And again, we provide that holistic assessment within 2 hours of receiving a referral, and provide a treatment sometimes over 2 weeks. And these people are typically referred from primary care to our GP services. So the next part of our UCR pathways is a falls and frailty car. So this car, it consists of a frailty therapist or a nurse, and we work alongside paramedics within SCAS, and we respond directly to 999 calls for patients that if they typically require a physical and functional assessment, but if it's not addressed, they would be conveyed to hospital. Then our third pathway is the front door frailty team. So this is in Basingstoke, and it tries to turn patients around in ED. So we work within that frailty team. It is provided by Hampshire Hospitals, but we integrate our staff within that service. So staff within all teams work within the ED department, the community, and in the frailty car. So this integration allows for improved patient flow and discharges, but it also helps with that staff development as well, so we can see what our other providers are given and their challenges that they face. And then the final pathway is to allow us to be accessible via 111. We've been profiled on and created a pathway on the local directory of services. So this allows that we're visible to NHS 111 providers and those that do integrated urgent care, so we can receive them referrals as well. So just a little graph, just a really quick one, just on data, just over the last 5 months, just to show the kind of referrals that we're receiving across Mid and North. So we average around 235 referrals a month, and each of those people will have about 10 contacts. So each month we're looking at about 2,350 patient contacts that our team have to help keep people at home. So whilst we are definitely seeing much more acutely unwell people at home, this is due to COVID and people deconditioning because they are scared to go to hospital. So we do obviously admit some people, and we don't see this as a failure, but what we do see is that because we've integrated with those other services, especially the acute sector, that those patients that do need admission are seen by the right people at the right time much quicker. They're on the right patient pathway. And just looking back at August, we did admit 22, so we kept 78% of them people at home. I can't see this, so I thought that was a real positive, that 78% of the people we do see. And the final slide is just, the patient is key to everything that we do. That they are central to everything. So I just wanted to share a little bit of feedback, and one from a family member who said that the team were just so thoughtful and kind, but also really professional and knowledgeable, which I think is really important as well. And then one from a GP that said that having that access to multiple disciplines just within one service just means there's more joined up care and that ability for patients to get the care quicker in a much more efficient way. And that's all from me. Thank you.
Thank you, Naomi. And it's a brilliant example of where during the COVID pandemic, we've stepped up this service. Naomi's from the North and Mid division, but we've stepped this service up across all of our divisions. And it's made such a difference to making sure we can support people in their own homes, but also keeping, as far as we can, pressure from the acute hospitals as we respond to the pandemic. We're now going to run a video which we've talked a little bit in the presentations today about the mental health inpatient improvements. And we've been over the last year and continue to expand and improve our therapeutic environments around our mental health inpatients. And we've also been investing in expanding our provision around community services with our community rehab wards to support the pandemic response and making sure we've got really good diagnostic equipment. So we're just going to run a video now which just shows some of the major capital projects in a little bit more detail that we've been implementing throughout this year.
ward is our newly refurbished 14 ensuite bedded dementia ward. This exciting project has incorporated the latest research and technology to support and enable our patients and carers in the recovery journey. This environment also supports the clinical team to develop new ways of working that enhance patient care every day. Rose Ward is our functional ward for older adults that is currently being refurbished to provide 14 ensuite bedrooms. This is again an exciting project that incorporates the latest research and technology to support and enable our patients and carers in the recovery journey. This environment will enable the teams to redesign the care they provide and ensure new ways of working enhance patient care every day.
Terry Ward offers single-sex accommodation for women. It's a ward environment that's been co-produced by service users and clinicians with the needs of women held in mind. We have a dedicated de-escalation space, a sensory room, a quiet room, and a communal lounge and dining area at the heart of the ward opposite the nursing base. All bedrooms are en suite and are painted in vibrant colours chosen by the patient group.
Juniper Ward is currently undergoing a renovation and will be reopening at the end of November, where it will provide single-sex accommodation for males. The work on the ward is being co-produced with both patients and staff to ensure we can make the best use of the space available, and in particular to increase the therapeutic space for the males who will be admitted to the ward in the future. Our patients have been involved in creating a new gym, a sensory room, quiet space, and choosing the colours of the walls and the soft furnishings.
Hi all, I'd like to talk about Abbey Ward, the redesign that we're undertaking in the centre of Antelope House in Southampton. Currently there is building work ongoing which is going to allow us to develop a female psychiatric intensive care unit so that we are going to be able to treat those who are in the highest acuity of their illness closer to home and allow them to have more contact with their communities and greater care from the services around them. I'd like to say a huge thank you to everyone who's been involved, both from the people who are actually involved in the building of the new unit to those in our patient population who have helped to guide us on the development of it. We are all so excited to see this finish in time for the new year and hope that it will be able to be up and running shortly afterwards to provide care for the local community. Thank you again so much from all of us here in Southampton.
At Melbury Lodge in Winchester, we're doing work to all three of our inpatient wards. On Stephen Oliveri ward, which cares for older people with functional mental health needs, we're improving the environment and eradicating dormitory accommodation. On Kingsley ward, which is our acute mental health ward, we're again improving the environment, but we're building in additional en-suites and creating separate male and female wards. And then on our mother and baby unit, we're creating a separate entrance for the ward, as well as provision of en-suite accommodation. It's a really exciting time for Melbury Lodge and really look forward to seeing the results. We're hoping that everything will be concluded by and done by the August 2022.
Hi, I'm Karen Critter, Radiology Manager for Lymington, Romsey and Hythe Hospital. The scanner is benefiting patients already because it has a wider bore, so it's making them feel less claustrophobic. It's more aesthetically pleasing in the room. We've got some lovely mood lighting. We'd like to say a massive thank you to the Trust for helping to fund this new scanner, to the procurement and finance team for all of their support, to the senior management, which is Laura Rothery, Lance Beattie, and also to Steve Tompkins, who came along on Monday as well.
Hello, my name is Liz Taylor. I'm the Director of Nursing and Allied Health Professionals for Mid and North. We're really excited to be building a new ward of 20 beds at Alton Community Hospital. This is to support our population and will be ready early spring next year. This will provide more opportunity to recover and rehabilitate close to home, as more than half the population of people over 65 need more support when leaving hospital. A big thank you to our partners supporting this work, and especially our staff who deliver great care and compassion every day. Thank you.
Hello, my name is John Pritchard. I'm Associate Director of Housing and Community Inclusion for Southern Health. So my role is fairly unique within the Trust, and it's all about how we can discharge people out of hospitals much quicker than traditionally they're able to do currently. It's a fairly unique position. We're the only Trust in the country to have a director level resource that's dedicated to housing and finding those housing solutions. So the objective of the work is all around getting people out of hospital sooner than they might be able to do otherwise. But more than that, though, it's about how we support them in the community, and not necessarily medically, but around what other support we need to put around them. So things like helping them become embedded in their communities, helping them become contributing members of their local economies. How do we help get them into employment and volunteering and training? Working with partners to make sure they've got the right support and helping them to lead their best lives. One of the new solutions that we have implemented over the past year or so has enabled us to discharge people about 3 months sooner than we would have done otherwise, which is incredible for those individuals, but also really, really important for us as a Trust and about managing our bed flow and our capacity. We're working with providers, housing providers, to create new solutions, and we need to do that because they either don't exist or traditional solutions just don't work for the complex cohorts that we work with. So when surveyed earlier this year, the individuals that are accommodated through one of the new step-out models that we've got talk themselves about how they've come on leaps and bounds, since their discharge, since they've lived in their flats. How their relationships with family and friends have massively improved. And how having their own space and their own sort of time to reflect on things has been really important and really beneficial for them. They say they feel relaxed and they feel comfortable and they feel in control. They've got time and they've got space in which to think and work through their ongoing mental health recovery. And they can talk about how they can think clearly and how they can now make decisions, and just having their own home and their own space has been fundamental to that. The positivity that shone through in that survey from those individuals was truly humbling and really quite inspiring. The stability of having their own home has been really important, and it's shown that none of the individuals that were accommodated through that step-out model at that time had an inpatient stay again since, and none of them had access to an emergency department for their mental health support since they'd been accommodated. The future plans really depend on the needs of the individuals and the different cohorts and indeed across the different locations. But some of the work underway is quite diverse. So we've got more of the same. We've got more of the step-out type model and exploring that in different areas, and that provides a long-term sustainable discharge solution for those individuals. Flexible support wrapped around the individual to keep them well in the community. It's a really, really cost-effective partnership approach with housing providers, support providers, local authorities and housing teams. And importantly, that accelerates the discharge process and prevents readmission. We're also in the process of creating some much closer integration with our local authority housing partners. So in a couple of areas we're just about to second clinical colleagues into their housing teams. It will enable community mental health teams to create a much more structured workload, because they won't be dealing with the crisis presentations that we get from local authority housing teams traditionally. And importantly, admission avoidance. So, how can we prevent these individuals coming into the system and becoming longer-term patients? If we can work much earlier in the process, perhaps even before people have become open to services, it will certainly enable us to slow down that journey that we see people going through today. Also looking at community solutions, so partnerships with people like Sport in Mind, individual placement and support services, so supported employment. We've got some great links building with citizens' advice across the area to really make those services and that advice and that guidance much more accessible to our patients. So lots going on, very diverse and right across the patch.
Good evening, everyone. My name's Sarah Burke and I'm the Head of Diversity and Inclusion here at Southern Health. And what I'll spend the next 5 minutes talking to you is about what we've been doing this past year, our key achievements for diversity and inclusion. And then I will pass over to my colleagues Pawan and Leon, who head diversity and inclusion and lead the work that we're doing in the ICS. So just some key achievements to go through with you today. So we've managed to reduce the gap with a number of BAME, Black, Asian, minority, ethnic and white staff receiving the COVID-19 vaccination. We managed to reduce that from 26% to 2%. We had an overall completion rate of the COVID-19 risk assessment at 98%. We continue to offer health checks for all members of staff. We've updated our Ulysses safeguarding reporting system. So now there's over 50 different categories that people can report incidents under. Anything that's reported under bullying, harassment, discrimination or abuse. Paul Draycott, our Executive Director of Workforce, Organisational Development and Communications, and myself as part of inclusion, we get copied into those incidents so that we can review those, we can learn from incidents, etc., and also support teams. It also allows us to be aware of any repeat incidents, etc., and use the correct reporting systems outside of the trust if needed. We've seen the introduction of our Vox Pop co-chairs, and our networks continue. So the Race Equalities, Disability and Allies, LGBT Plus and Allies Network, and the Spiritual and Allies Network, which was also launched this year. With a growing appetite, so last year, back in October, we saw our first cohort of international nurses that joined us, and we now have got a bit of a growing appetite for an international nurses network. So October will see the launch of that network as well, and we'll work more closely with those. We've also seen a growing appetite for people to be asking for monthly network, Vox Pop network meetings, and now having more attendance than ever. That's something that we are looking to possibly introduce to. We now have over 10% of Southern Health staff which are allies, and our Southern Health Ally programme is being used by the ICS as well. We've seen the appointment of 2 NEDs, which obviously Lynn mentioned earlier as well, and Suba led a fantastic Q&A session on. So Suba and Ade have joined us, and they have that inclusion focus too, which is fantastic. We continue to encourage people to use equality impact assessments to review policy and procedure, new initiatives, etc. And we have seen an increase in the number of quality impact assessments that we are completing this year. We have our translation interpretation services, so we've used over 2,000 hours since our last meeting. We see staff using those to translate documents, appraisals, etc., as well as patients and service users. We've continued our media coverage, so on local community radios, etc., and we've broadened our job advertising as well. We've seen a fresh look inclusion webpage, and we continue with our engagement events. So Pride, Black History Month last year saw more than 200 members of staff engage in our sessions over that month. So we're hoping to have a similar pattern this year as well, and more. So that'll be fantastic. We continue to work with community groups. A lot of those sessions are now online. So what we used to do face to face just to keep everyone safe is online, but we continue to engage with local community groups, local councils, etc. as well. And we have seen the launch of our diverse panels. So what that is any interviews that are taking place from this week from band 7 to 8A, they will see a member, a diverse recruitment ally that will attend that panel, and they will be able to sit on there and ask some legacy questions around inclusion. We then have that aspiration that in January we'll launch it throughout all our panels, and every panel will have a recruitment ally on there. We will be launching divisional dashboards, and that's something we have started doing as well. So each division will be aware of their individual data, etc., race disparities, etc., and divisional inclusion days, which we have coming up and set up for our divisions. Mandatory yearly EDI training will start in October 2021, and we'll also be launching our equality standard in October. The 5 priority areas of priority are data, policy and research, education and improvement, employee experience, and survey user experience. So what that involves is a trust workforce policy review, and we've seen an updated review of our equality, diversity and inclusion policy, bullying and harassment policy. So they're just 2 of the ones that we've reviewed this year. Education improvement, so reciprocal mentoring and talent management, that attraction, that retention of staff. Employee experience, so we've talked about diverse panels and having those diverse panels throughout all our for all interviews. And then service user experience, so the experience of service users and how we can improve that. So that's our key areas of focus this year. I'll now pass to Pawan and Leon, who are leading on our work for the Hampshire Isle of Wight ICS.
Thank you, Saab, and good evening, everybody. My name is Pavan Lal, and Leon, would you like to say hi to everybody?
Good evening, everybody. Leon Ghulam, and working alongside Pavan as the BAME Population and Workforce Leads for the Hampshire and Isle of Wight ICS, and we are currently being hosted by Southern Health.
Thank you. Thanks, Leon. And it's a great opportunity for us to share with you and give you an overview of the type of things that we are involved in currently. We've been in post about a year on secondment. So in this year, what we've done is set up work streams across 7 areas. Recruitment and talent, recruitment, have the slides gone? Sorry.
Yeah, sorry, I was told to stop sharing. Sorry, shall I carry on?
Okay.
I can carry on sharing. Sorry, I was told to stop sharing. Sorry.
Okay, that's okay. Okay, so the 7 work areas work streams that we have currently running across Hampshire and Isle of Wight, with involvement of all of our trusts are engaged within this, are recruitment, talent management, communication and engagement, education and training, data and information, and having difficult conversations. So all of these are about unblocking and building back better. It's about doing things to be more inclusive and having better systems in place so we can drive change across our equality, diversity, and inclusion agenda. Over to you, Leon.
And another aspect of the 7 work streams is health and well-being for all of our workforce across Hampshire and the Isle of Wight. And maintaining good health and well-being is essential for all of our people. And as a system, we've developed an enhanced health and well-being programme, which has involved a partnership really of all of our organisations, including Southern Health, across our system. And a people portal has been developed, which is an online platform and is available for all to use, which has lots of resources on there to help maintain and improve a healthy lifestyle, and it includes support for mental health issues, MSK issues, and a whole host of other aspects of support. So we're working to ensure that these offers are as inclusive as possible for all of our populations. And we have a strong focus on our population health. and in particular for those areas of our populations where there's higher levels of deprivation. And we currently have, again, various work streams to help to reduce health inequalities for those most at risk. And one of these areas is looking to introduce health checks. And health checks could be something as simple as carrying out a blood pressure check or a pulse check for those who are coming in for their flu vaccine or their booster vaccination. And pulse oximetry, lots of our patients locally, particularly post-COVID, have been offered the opportunity to take on a pulse oximeter to use at home to monitor their own blood oxygen levels. And there's been quite a lot actually in the press recently about the effectiveness of these pulse oximeters in those patients who have darker skin. But it's really important, I think, for me to highlight here today for anybody who's listening, that it's essential that you continue to use that pulse oximeter because the benefits currently far outweigh the risks of stopping using the monitor. And we've also played a bit of a hand with the COVID vaccination programme over the last year or so, and we're looking to reach as many of our diverse populations to encourage uptake, to help share the messages that the vaccine is safe to take, and also to debunk any myths. I'll pass you back over to Saab now.
That's it. Thank you. Thanks, Pam, and thanks, Leon. And I hope that provided you all with an update. And please do contact us for any further questions, etc. as well. Thanks, Lynn.
Okay, so hopefully you can hear me now. I've moved from the boardroom into the forest, and clearly that's worked well. I've actually changed and gone into a different room. So thank you everybody for bearing with us. Everything's up and running now. So here we go. I just want to say a huge thank you to Heather, Naomi, John, and to Saab for those presentations. Each one of them in their own right really kind of shape where we are at the moment, show where we are at the moment in shaping our services in a different way. And Pawan and Leon, thank you so much for being with us and sharing our journey. What I was trying to say earlier when I couldn't get myself heard was that when Naomi put her slides up, she had two quotes from people talking about our staff and talking about how caring, kind, friendly and supportive they were. And I can't tell you how many times as a trust we hear that about our staff. And every time I hear it, it makes me really, really proud of people working sometimes against all odds and working in incredibly difficult circumstances and still are able to show that compassion and kindness and support and sometimes love for our service users. So I know we're going to say thank you all the way through this evening, so now the big thank you. And with regard to the last presentation, that's all of our staff, every single one of them, and people need to feel supported at work. So thanks to Saab, Pawan and Leon and everybody involved in your work. So I'm going to move us on to the next video. So we have two videos. Long COVID and also vaccination. So I'd like you to watch both of those and then we can come back and catch up after them. So thank you very much. Just spend some time watching these two really important videos.
So Long COVID Clinic is a clinic which has been established to help people with prolonged symptoms following a COVID infection. Southern Health has been very proactive in setting up long COVID clinics across the area to provide care for these patients. Working with partners in Solent and also in the hospitals, the impetus for this setup came from the central government providing some funding, and also there was clearly a clinical need. So Southern responded by establishing multi-practitioner, multi-professional clinics to provide care and help for those people from primary care with long COVID symptoms. Some of them have been particularly unwell and they've needed to be in hospital, and they've therefore needed rehabilitation post maybe the on ITU, and they've come therefore from the acute hospitals, from Southampton, from Portsmouth and other areas. Others, and in fact more of them, are coming directly from primary care. They're going to see their GPs with prolonged symptoms, maybe 8 to 12 weeks after they initially had COVID, and the GPs are then saying, do you know what, you need some help from our long COVID clinics.
So I'm an occupational therapist and I'm one of the people assessing the patient. So our clinics are set up to run an assessment and rehabilitation and onward referral service for people that experience ongoing symptoms of long COVID. For example, fatigue, breathlessness, joint and muscle pain, sleep difficulties, brain fog, and many other symptoms. So we work with them to manage their symptoms, trying to give them the correct advice for how they can look after themselves. We have an app that we use as well to help patients. There's lots of information on it, and they can use the fatigue diary and they can message us through that as well, which is really helpful. We've recently received some more funding, and so we're going to set up some workshop kind of groups for patients looking at specific condition management. So for example, fatigue, something along breathlessness and sleep, to really help patients that way as well. We've had really good feedback so far. Lots of people tell us we're the first people that have actually listened. So often they've seen numerous other healthcare professionals, but nobody that specialises in long COVID. And it's a real opportunity for patients to tell their story, which is really helpful for our assessment and also really helpful for the patients as well. It's a really key part of the clinic, I would say, is to listen to that story to begin with. And people are always really thankful for that. And when people then show signs of improvement and are doing well and return to work and get back to all of their normal daily activities, whether that's looking after children or elderly relatives, getting back to work and getting back to some form of exercise again, it's really nice to hear that they've improved so much during their journey.
Since the clinics were set up, we've seen overall over 1,000 patients. But there are many patients to see. We've got some new funding come from central government, which is going to allow us now to expand our services dramatically, which will enable us to see those patients. And it's an exciting time with these services now expanding and getting better.
So it was an amazing piece of work that so many people and so many of our staff supported being part of. And also we partnered with Solent, our other community provider, to come together and think about how we could, in the most effective and efficient way, vaccinate our staff as quickly as possible. There was a huge national campaign in terms of asking for volunteers to come forward, and they really came in their droves from all walks of life, and we knew that some people were furloughed from their own work and they came, and so we had people from fire service volunteering, from the general public, from our different religious communities. It really felt like a whole community effort coming together to achieve one goal. So I think the thing that I really want to say is a massive thank you for all that stepped forward, that were involved in that. I know that people have been saying that this is stories that they're going to be sharing with their family, grandchildren to come, that they were part of the vaccine programme.
Thank you. Thank you very much. Great videos, and how right Julia is about the kind of stories that people will have about in the future, being able to talk about being part of these programs. So thank you very much. We have one more video to play, and this is the psychological impact of COVID. and some pandemic research that the Trust has been leading on. And the presentation is going to be by Shania Rathod.
Thank you very much, Lynn. For those of you who don't know me, I'm Shania Rathod, consultant psychiatrist and director of research for Southern Health. 2020 has been a very busy year for the Southern Health Research Department. I don't think anybody will dispute the fact that we are all out of our homes because of research, because of the vaccines that research has produced, and we have contributed to many national vaccine-related projects and regional projects as well. So I'm going to share my screen to show you some of our work. The COVID-19 pandemic has presented challenges for the entire globe. The research team at Southern Health has worked tirelessly throughout the last year to make sure that we have participated as a team in urgent public health trials, in COVID-related trials. I have no doubt that the evidence that we are collecting will add to the database of evidence, not just for the coming years, but for future pandemics and global crises.
Here at Southern Health, the R&D team and the MARC team have significantly contributed to the delivery of the NIHR CRM portfolio research. The team have supported both urgent public health research and COVID-19 related research and delivered to such key studies as CCP, which is the Clinical Characterisation Protocol Study, and the SIREN study. The team also led one of the largest observational studies.
The international survey came at a time when our colleagues were working hard on the vaccine, but we also wanted to look at the mental wellbeing side of things. As sponsor of the study, we had limited resources to manage over 350 sites in both primary and secondary care. At the end of recruitment, we had 112,000 UK participants and over 25,000 participants from our international collaborators.
I was the principal investigator of the SIREN study. This is a urgent public health study that we delivered at Southern. There was quite a few challenges of setting up a study at Southern Health, largely because we are a community trust, so our staff population is spread right across Hampshire. We also don't have access to testing facilities, so we needed to liaise and negotiate with our partner trusts of UHS and Portsmouth.
We implemented systems and processes to enable the SELECT study, a global cardiovascular outcome study, to continue. Throughout these difficult times, we not only maintained regular engagement with patients and continued their study visits, converting them to virtual visits, but despite the pandemic, we managed to achieve study recruitment well above our target. And we gained the largest recruitment in the UK at 160%.
Hello, my name is Claire. I work for the Memory Assessment Research Centre. We volunteered working on the AstraZeneca vaccine trials with the University Hospital Southampton. We have been recruiting throughout the pandemic period to the Principal study, which is one of the largest primary care studies for COVID-19. We've also supported our dementia patients through telephone calls and offering them an observational study looking into the effects of lockdown and isolation. This is called the Solitude Study and is in collaboration with Sheffield Teaching Hospitals.
COVID-19. I think that was a just whirlwind tour of what we did through 2020, and lots of exciting projects starting soon as we are in recovery mode. Please be in touch with us if you want to know more.
Thank you as always, Shania. Very, very interesting. And thank you to all the presenters there on the COVID-19 section of this meeting. We're going to go to another question and answer section now. And Addie Williams, I think, will be available to us to try to coordinate the questions and direct the questions to the appropriate executive or any other member of the board. So hi Addie, I can see you now.
Hi Lynn, I hope everybody can hear me fine as well. Is that okay? Good. I think I haven't just listened particularly to the last few presentations that we've had, one is everybody's going to be gripped by the breadth of the work, the brilliant work that happens in Southern Health, and we mustn't lose sight of that. And rightly so, also the passion and the dedication to excellent care. We've got some brilliant questions coming through here, and I'm going to ask the help of our executive team to help us just navigate through this to get to the answers. This is a good one that's come through. It's about our equality impact assessments, and it says, I would like to know how many equality impact assessments have been submitted and approved in 2020-2021. Now, that is the question for somebody that's got the numbers at their grip. So I'm not sure we're going to get the numbers come back to the person that's asked this, but I'm sure that one of the execs will be able to tell us how we approach those equality and impact assessments in the care that we provide.
I think everybody's looking at me. I'm guessing yes. So I've just checked with Sav. Actually, we did 47 last year, 47 equality impact assessments last year. And I think the movement, as you say, Addy, is to try and move away from the tick box approach that I think came out following the Equalities Act and just ticking the box to say yes, we've considered this. To actually getting it to be real and getting our services and our people policies, as Saab alluded to in a presentation, to try and make sure that we actually look at the fundamentals of that and making sure that we consider properly the impact on different groups within our communities and within our workforce, but also how we look that then looks in terms of the intersectionality, how that works within those groups and across those groups, because we know individuals have, they don't just have, they're not just male or female or black or white, we have intersectionality across the whole of that, and people have come from many different backgrounds, which creates the rich tapestry of our workforce and of our communities. So that's certainly where we're moving, and also, Pavan and Leon working across the system. That's one of the areas that they're working on as well, to try and help the system better work through the equality impact approaches, so that we assess more accurately and more comprehensively, and use it as a developmental way of looking at how we when we change services and we look across the ICS at initiatives across the ICS, how that impacts on different communities, rather than just having a tick box and looking at a few numbers. Really understand how that impacts on communities. So it's a really great question, as you say, and I think there's more work to be done, but again, it's something that we're taking forward all the time, and with Saab and the team, we are taking it forward all the time.
Thank you very much for that, Paul. And I think the reassuring thing for everybody to know is that it's not just about doing the assessments for us. It is actually about how that assessment helps us to deliver the person-centered care, which is what the trust really sets as its own particular target and it prides itself in. Now, this is a question I know every one of the execs would love to answer, but so I'm going to ask this because I think even I know the answer to this. And this is what's been asked of us. It says, do you support someone with mental health and that is a carer? I think the answer to that is yes, and I think I've seen that from the previous one. And Paula Hall's nodding her head that I think I'm going to hand this one to Paula, because I think we're going to get not just to find out that yes, we do it, but how we do it.
Yeah, absolutely, Addy. We are absolutely committed to enabling people that have been service users or have had issues with their mental health, working with us within the organisation in all sorts of different shapes and sizes. But we really, really value people's lived experience and really keen to have that shared with us so that we can help shape our services and work with our staff so that they understand really well what it feels like to be in that situation. So it's something that's really, really important. So we absolutely welcome and promote that, Abby.
Yeah, and I think if there's anything, I guess, that we can add to that is that if you are a person who suffers from mental health in any way, and you happen to be a carer, I think one of the things that the trust would also say to you is please get in touch, actually, because if they know that that's your situation, they'll be really ready to wrap their arms around you and also to hold your hand and support you. So that's, if you know anybody or that's why you're asking the question yourself, please reach out, let people know, and they'll be more than happy to help. And this is going to be our last question, I believe. And I think this one may be one for Heather Mitchell, but I could be wrong. It's asking about our quality improvement program, and it says, how well is the program of quality improvement proceeding? And it says, is it becoming embedded in the work of the trust?
Can I answer that one? Is that all right? If you don't mind me jumping in.
Yeah.
Paul, fantastic question. Thank you so much for asking it, because quality improvement is so much, part of me and is so close to my heart. As we know, quality improvement is, as the name suggests, about improving absolutely everything we do. And it's not the responsibility of just a central team. It has to be the responsibility of everybody. And when I say everybody, I don't just mean colleagues across the trust. I mean everybody who has any touch point with us as a trust. Because as a service user, as a family member or a carer, your journey into our services will be very different. You'll see different things to what we see. And if you share that with us, then we'll be able to improve the quality, as I said, of everything we do. The question was about how is it proceeding? Well, it is proceeding. Unfortunately, COVID did cause a slowing up of the process. A number of the central team who specialise in encouraging quality improvement were redeployed to more clinically facing roles, which was appropriate. A lot of them are now back in the quality improvement team, and it is proceeding, I want to say at pace, but it is picking up pace. We need to energise it, and I think that's what we are doing. We've getting encouragement externally from Mr. Pascoe himself, from the CCG, from NHS England, and the board are giving us real encouragement to re-energise the quality improvement programme. So it is embedded. We are encouraging it to, as I say, speed up, to be energised. There is a lot more work to be done. However, having said that, when you look at the list of projects that they are presently doing and the list of projects that they have already acted on and the improvement they have delivered, it is really awe-inspiring, and it's definitely something for the future that we will keep close to our hearts. Thank you.
Thank you very much. Thank you very much. That's Steve Tompkins, our medical director there, just really answering that question and really emphasizing the importance of that to Southern Trust. So I'll hand over to Lynn, who is our chair, and to help us with the last bits of our program for this evening.
Hello. I really hope you've enjoyed this evening as much as I have. It's been absolutely fantastic. And every year, when we look back at our annual members meeting, it's just a reminder of the fantastic things that our staff do every day when they come to work, and all of the things that the board is supporting. So I hope you found it interesting and enjoyable and informative. If there's anything you want from us going forward, any questions aren't answered, and as Addy said, if there's anybody out there who wants to get in touch and do any kind of work with us or need support from us, then please do that, and we'll be always happy to be in touch with you. So thank you, everybody. Thanks to the execs and the non-executive directors. Thanks for everybody who's supported this evening and set up this wonderful event, and take care. Bye-bye.